Hello and welcome to today's Partner Infopedia web conference. This is Transforming the Way to Healthcare Supply Chain Can Positively Impact Patient Safety and Quality. Hosting for us today from Microsoft, we have Tracy Picone, Director of Healthcare Solutions. And presenting for us today from Mazik Global, we have Pat Becker, Chief Strategy Officer in the MazikCare division. Okay, Tracy, the floor is all yours.
Thank you so much, Leslie. Hi, everyone. I'm super happy to be here today. Thanks for joining. We are going to go over supply chain management and showcase MazikCare's amazing solution for supply chain management. And really, let me back up. I'll introduce Pat. So Pat Becker has over 25 years of executive leadership, executive healthcare IT experience. She's a former CIO of the University of Chicago. She's an adjunct faculty member at Northwestern University and also a HIMSS fellow. She has phenomenal, extremely amazing knowledge in the healthcare IT realm. And so today, when she goes through talking about supply chain and the transformation of the supply chain, you'll get a sense of what MazikCare can offer to our customers. So real quick, I'll just go through the agenda. We're going to go over Microsoft and health, the supply chain journey in healthcare, really the importance of the supply chain. Pat's going to talk about a few case studies, and then there will be time for questions and answers at the end. So really what I want to cover for just a couple of minutes is the core theme of the supply chain, the healthcare supply chain, and how it impacts patient safety and the quality of a care. And what we're really hoping to get to talk about today is really how technology empowers not only the patient, but also empowers the provider to bring that human element back into healthcare. But how then taking technology and expanding its capabilities to optimize the clinical effectiveness. What is it that the physicians, the providers, the organizations actually need to provide better healthcare, more engaged healthcare, empower their patients in their healthcare? But also, then how do you optimize the operational effectiveness of your organization? What does that look like? And ultimately, how you take that supply chain management, the optimization of your clinical and operation effectiveness, and use it to transform the entire patient journey, transform the entire provider journey in that patient care realm, and then transform the journey that the hospital organization goes on. So without further ado, I will turn it over to my friend Pat Becker, and we'll get started.
Thank you, Tracy. It's good to talk with all of you today. I wanted to talk a little bit about the patient journey through healthcare. At each interaction with the patient, supplies are used, whether it's medication in the ER, perhaps a medical intervention is done there. If the patient has imaging services, supplies are used there. It's important to track what's done to the patient and what supplies are used in order to understand the true cost of care. This becomes particularly important if the patient is admitted and perhaps has surgery, where many more supplies are utilized. As devices are implanted, the specific manufacturer, serial number, and the origin of the device needs to be recorded and matched to the specific patient. Why is this necessary? Devices and implants can be recalled, and the ability to find the patient quickly and offer follow-up care may impact the effectiveness and the quality of that care, not to mention the reputation of the healthcare organization. Does a more expensive implant lead to a shorter recovery time for patients? These are questions that today are very difficult to answer. What alternative treatments and equipment may be used to create shorter times for rehab and the return to normal work life? So today, about 6% of U.S. spending on healthcare is spent on the chronically ill. Those costs are about $1 trillion today and expect to climb to $4.2 trillion by the year 2023, with about 157 million patients by 2020. These patients are the largest consumers of supplies, whether they're medications or implants or the use of medical devices. Yet to date, there is little knowledge of how particular supplies impact care and what the outcomes of using one implant versus another is. The potential of impact to both the quality and the cost of care is huge. Having a robust supply chain system benefits all the players in the system. Patients have a better ability to know that they have safe, effective care, and if there are any adverse events, have an easy way to report them. Physicians are able to better track what they're using and the outcomes of that, as well as the healthcare organization can look at a broad population of patients and surround that care that they're going to provide from the benefit of knowing what the cost and the quality outcomes are. And then eventually, of course, everyone is benefited by using the most effective supplies on the patient throughout the entire system. This data from Definitive Healthcare shows that these hospital supplies cost is now a greater cost than personnel. Most of these hospitals are specialty care hospitals, either spine or surgery, and it shows the growing trend of increased costs moving into the supply chain. As little as 5 years ago, personnel was the largest cost, and now we're seeing that slowly supplies and medication are taking up that number one cost. Excellent. So let's talk a little bit about medical errors. This is a disturbing trend. Medical errors is the third leading cause of death in North America after heart disease and cancer. In 2014, there were 23,000 Canadians experienced death that was preventable. In 2016, in the U.S., there were over 250,000 deaths related to medical errors. This has been an ongoing problem since the release of the Institute of Medicine report to Error is Human in 1999. In 17 years, there has been virtually no change in the rate of errors. So we're going to spend a little bit of time talking about supplies and how supplies can impact the rate of medical errors. One thing that is a big issue within the healthcare system is the use of physician preference items. So these are items or devices that are used in medical procedures at the discretion of the physicians. Physicians often choose these devices on their own, such as implants or pacemakers, based on that's what they're used to using, or they have some kind of a relationship with the vendor. These items may constitute anywhere between 40 to 60% of a hospital's total supply chain costs. So as a sub-factor of supply chain, it's one of the biggest line items in there. And the trend is moving upward. A decade ago, they constituted 40% of the cost. Today, they're moving closer to 60. What are the issues with that? They often bypass the organization's usual purchasing process, meaning they are not well tracked and it is difficult to know their effectiveness and the relation of the device to patient quality and outcomes. It's estimated that today 1/2 of orthopedic procedures use physician preference items and 1/3 of cardiology procedures. Another area of concern is the growing use of implants. It's estimated that hip implants will increase by over 137%, and knee revisions will increase by 601%. So it's really important, as this growing trend, is to know what devices are being put into the patient so that, again, we can monitor the outcomes of those devices on the patient. I'm going to go over one case study that we ran across. There were more than 540,000 patients that received metal-on-metal joint implants in the United States and the UK. After about 4 to 5 years, evidence began to accumulate that these patients were actually at high risk for device failures. How do we go about finding 450,000 patients if we don't have the data available to us so that we can effectively help them with surgery and rehabilitation that must be done? And then, more importantly, who's going to pay for that cost? We know that a big burden of that cost is likely to fall to the taxpayers, since many of these patients will be Medicare and Medicaid patients. So this is just one example, and you can see we're talking about 500,000 people here who are affected by just one implant. So when you think about the future state, we need to think about what systems we're going to have in place that will allow us to effectively monitor as we move through the taking care of patients. And one of the more positive occurrences is the implementation of GS1. GS1 is a standard, and the idea is to identify a supply, a device, an implant from the time of manufacturing using one number, and then that number is used throughout the life of that device. So it's used from manufacturing to purchasing to inventory to the procedure, and then finally to the patient, eventually allowing for the tracking of outcomes for that device and types of devices and the quality of those devices on the patient's outcomes and probably incomes too. Excuse me. As well as being able to marry that information with patient follow-up so that if a recall was needed, that recall can be done quickly and help the patient with any follow-up service, as well as help with the reputation of the organization. The same kind of thing can be used in drugs, although drugs have had a standard numbering system for a number of years, so it's actually easier to do that with medications than it has been with devices in the supply chain. So what are some key takeaways that we have? We know that up to 60% of hospital operating costs are tied up in the supply chain. We know that the chronically ill population is increasing dramatically, and that the cost of taking care of those patients is dependent on medication supplies and a number of other factors. We also know that medical errors are the third leading cause of death. Without robust information about what supplies are used when and what the outcome of using those supplies are on the patient population, that medical errors being the third cause of death is not likely to go down. With a robust supply chain management system, There's benefit to the patient because the patient is able to receive safe, effective care. The physician is able to benefit by being able to know what supplies were used with the patient. And the healthcare organization is able to benefit by having inventory savings, automated safety reporting, and accurate data on the value of the supplies. And then the industry as a whole is able to bring insights into the patient population and insights into the product use and adverse events and medical errors. So we believe that the Dynamics 365 solution offered by Microsoft has all the components that offer a solution to allow for the immediate use of standards like GS1 and the tracking of supplies from the manufacturer to the patient, mirroring the outcomes through the use of its Microsoft BI tools with the supplies used to provide care. We have just a few screenshots of the MazikCare version of the Microsoft supply chain. So we're offering a Tech Talk in June that will be made available to you to discuss in more detail some of the issues and items that we brought up today. So Taylor, are there any questions that have come in?
Thanks, Pat. Excellent presentation. That was really helpful to explore the supply chain and how it works in healthcare and why it's so important to keep track of. We have had a few questions come in, and I will go ahead and start with one of those. The first question that I have is how does using software that's hosted in the cloud affect supply chain operations?
That's an excellent question. Thank you for that. By using products like Dynamics 365 in the Azure environment, the first thing you have is complete redundancy of your data and the ability for having disaster recovery be very seamless. You have close to 100% uptime. Using modern technologies like Dynamics 365 that is able to work with standards like GS1 to monitor things like supply and medical devices as it has a relationship to the patient as well as to medications. So all of your data is in a modern, robust environment, completely HIPAA compliant. And then with the use of the Microsoft BI tools, along with the data that you're gaining from the supply chain, you're able to look at outcomes for the patient, both positive and negative outcomes, and that can then influence the physicians as you talk about physician preferences.
Excellent. The second question that I have is how are patients impacted specifically by an improved and more efficient supply chain?
Well, when you can marry standards like GS1 with outcomes, you have the outcomes, you have the patients, you know the devices, you know the medications. You're able to quickly find and prevent adverse events. And if there is an adverse event, you're able to quickly put into place processes that will mitigate that event because you're able to get to the patients in a very efficient manner and contact them and then bring them back in if they need additional care. So there's a shorter recovery time that will allow the patient to get back to the more normal activities in a quicker time period.
Okay, that makes a lot of sense. Thank you, Pat. Another question that we have are, if you're first considering, transforming your supply chain, what are some of the first steps that need to be taken, first priorities that you should look into?
So one of the first steps is to make sure you're working with a robust system that allows you to track the supplies from the point of ordering to utilization with the patient. Again, being able to marry all information so that you can quickly determine which patients may be affected by a particular item can't be overstressed. Importantly, it helps you determine the total cost of a medical event, a surgery, an implant, a course of medication treatment. Because you've tracked the supplies needed to provide the care, you have the total cost of what it takes to provide that care, and then you're able to look at that and look at the outcomes, both positive and negative, and you're able to compare different kinds of supplies and their different outcomes for the same treatment.
Excellent. That's a great point when it comes to starting to transform your supply chain. In considerations related to the supply chain, where is it okay to reduce spending related to supplies, and where is it not okay to reduce spending?
This is a tricky question. There have been a lot of studies that show that in order to have an impact, remember that supply costs are now 60% of the cost of doing healthcare in a hospital environment, and 60% of those costs then are related to physician preference items. So it's very difficult to move physicians when they're used to using an implant or a device to convince them to use something else. And the best way you can do that is providing the data that shows that a different implant or a different device has better quality outcomes and the cost is lower. But in order to do that, you need data, and it's best if it's delivered by another physician to that physician. Physicians being able to look at data that they trust and then being shown that something else perhaps works better than what they're currently using can be touchy, but they're also open to moving forward when they can be convinced of that. But the only way you can do that is to present the data in a very robust manner to them. And tools like Microsoft BI tools, being able to marry supply chain data with patient data and patient outcomes are the key to being able to perform that kind of analysis.
Excellent. And one last question here. The business of healthcare, the patient should always be put first. Related to the supply chain, how do you put the patient first when making these tough decisions?
Again, I think it's data that helps put the patient first. When you're able to show the benefit of using a particular type of supply over a different supply, you're able to, again, show that the patient care is improved by using that. Going to the hip knee, we saw that the cost of those is continuing to go up, but there's new technologies available all the time, and so we need to be able to prove those technologies have value, particularly if the cost is a little higher. And again, you can't do that without having effective analytics to show the physician that that's the case.
Excellent. Thank you, Pat, for answering those questions and for the excellent description of some pain points and things to consider throughout the supply chain, specifically related to healthcare. Again, we wanted to touch on, we'll be having a tech talk in June to go a bit more in depth into the solution. We'll be talking more about Dynamics 365 and MazikCare to really demonstrate how all these pain points related to medical errors, patient outcomes, and increased efficiency of the supply chain can be solved. So thank you for joining us, and I will pass it back off to Leslie.
All right, thank you. I'd like to extend a great big thank you to our presenters today. Thank you, Tracy. Thank you, Pat. Thank you, Taylor. And we'd like to thank you, audience, for logging in and joining us. Have a great day.